This is Barbara Reese reporting for This Week in East Brunswick, and we're very fortunate to be here today at the Raritan Bay Medical Center with Dr. Lawrence Chaise, attending radiologist. So tell us a little bit about 3D mammography and mammograms in general and their importance.
Well, 3D mammography is also known as digital breast tomosynthesis, and this is the latest advancement in mammography. It aids the breast radiologist in detecting the smaller breast cancers when they're easier to treat and improves the chance of survival. It works by enabling us to see the internal architecture of the breast. The radiologist is able to scroll through the breast and see thin layers of breast tissue instead of a global picture of the breast as we see with the current 2D technique. This has been especially helpful in women who have dense or extremely dense breasts. The 3D mammogram technique or tomosynthesis helps not only in detecting breast cancers but also has decreased the recall rate. There have been multiple studies throughout the United States in multiple hospitals, and over 100,000 patients have been reviewed. And the research has shown that 3D mammography increases the detection of all breast cancers, approximately 15%, and most importantly, the 3D technique combined with the traditional 2D technique increases the detection of the most serious breast cancers, the invasive breast cancers, by up to 40%. That's a big difference. And so in addition to increasing the detection rate, the 3D technique reduces the recall rate. And the recall rate is when a patient has a routine screening mammogram. She is a patient who has no symptoms. She comes for her mammogram, and she may receive a letter from us or a radiology facility that states that she has a questionable abnormal finding on that screening mammogram, and she has to return for a diagnostic mammogram and possibly an ultrasound examination. When we do the 3D technique, which is combined with the 2D technique at screening, it reduces that recall rate. It reduces the number of false positive examinations. It also eliminates the cost involved to the patient in coming for another mammogram and ultrasound, and also it has been shown to decrease the number of unnecessary breast biopsies that are done for benign findings.
And when do you recommend that women come in for these screening mammograms?
The medical societies recommend that women begin mammography at age 40. And the reason for this is that 1 out of 6 breast cancers occur in the age group from age 40 to age 49. And then annual mammograms are recommended after that as long as the woman is in good health. The frequency of mammography is something that each woman should discuss with her healthcare provider, with her physician. In addition to that, the American Cancer Society, gynecologists, radiologists, surgeons recommend that women perform monthly self-breast examinations because it is often a woman who discovers a lump in her breast. Usually these lumps are fortunately benign, often cysts, often normal breast tissue that simulates a lump in the breast. So if a woman develops a lump in her breast, she should make an appointment with her doctor and let her doctor examine her breast, and a doctor will determine whether she needs a diagnostic mammogram and ultrasound to determine if that lump is something serious that may require the patient to see a surgeon and have a breast biopsy.
And I understand you also use MRIs to help those women who are high risk for breast cancer?
Yes, we do. There are certain women who may begin mammography earlier than age 40, and those are women who have a higher risk of breast cancer. I should state that most breast cancers occur in women who do not have a family history of breast cancer. About 75% of breast cancers are in women who do not have that family history, and that's why a screening mammogram is important, because breast cancers can be seen on mammography several years before it becomes large enough to be a lump. But if a woman has a first-degree relative, such as her mother, her sister, her daughter, who developed breast cancer, particularly at an early age, she may begin mammography prior to age 40. And if she is at high risk because she has a genetic predisposition such as BRCA1 or BRCA2 or other hereditary syndromes, or if a woman had a prior breast biopsy that showed that she's at high risk for breast cancer, then there are other screening tests, such as breast MRI of both breasts, that are helpful in finding some of the early breast cancers. The other screening test that is utilized is a breast ultrasound that is performed of both breasts, and we do that in our department at the hospitals, and we also do breast MRI for this. So we have various screening modalities that we perform to keep women healthy.
Thank you, doctor, so much, and it's good news to hear that such a wonderful facility exists so close to home.
Thank you, Barbara, very much.